What's going on, y'all? This is Jackie Marie of J Marie Booklist. So today I am making a video about snooping and accessing patients' records. So, you know, just because you have access to a patient's information doesn't mean you should really look at it, even though it may be at your fingertips. So there was this article about a employee who for 11 years snooped in 7,000 patients' records. So they looked at their uh, name, social security number, health insurance information, address, birthdays, treatment information, all kinds of stuff. Now, the employee wasn't a medical provider, so like they weren't a doctor or a nurse or anything like that, but they did have access to the patient's record as part of their job coordinating patient care. So I don't know if that means like they worked in like um like in the ER, how when a patient's being admitted, like I think they call it like the patient access something. They have different names for them. So I don't know if that is what they did. I don't know if maybe they worked in ER and that's front line. You might have that, when they're filling out the forms. Like, so not necessarily the patient access record, but like when you are like the front line. So if you go to the ER, there's a person that's sitting there that's taking in your information. So I don't know if it was a person like that, or if it's a person who comes around and gets your, when you're in the ER, if they get your uh, insurance card, payment, stuff like that. I'm trying to think of who else. Who else would have access to? I don't know if it could have been medical records. You see a lot of stuff. So just because you have access to it doesn't mean you should be looking all at it. So like as unit secretaries, we really don't have access to it because a lot of hospitals have cracked down on that, and it's on a need to know basis, or if it is in the system, it's blocked, so you can't access it. Like if you have no reason to see the social security number, then you will be blocked. So you do have that, but sometimes just because you have access to something doesn't mean you should see it. So like I never saw people's social security numbers working as a secretary. There might have been times where ER might have sent up a form and it might have had it on there, but look, when they come up from ER, we getting these charts together, and because halftime when they come up from ER, they come is at change of shift, so we try and get these charts thrown together and we really ain't paying attention to it. But this person, like for 11 years, they snooped, and y'all do understand they can track you when you're on the system. They can track you and see what you're doing. I remember one time we had one of the hospital administrators was on our sister floor because he was having chest pains, and so I was working that floor that day, and what y'all know, I got a routine where I would probably about 5 times a day I would go through all the charts like on the computer, go through all the charts, and just to see if I missed any orders or things like that. I had a routine. I got a routine. And when I say I got in and out of his chart so fast, okay, I did not linger on nothing because he really didn't have any new orders. It was like certain doctors were on him, his nurses on him, because he wasn't there that long, but he was like the VP or something. And yeah, no, I was in and out of his chart because they can track all that. They can track on what you clicked on, what you're looking at, how long you were there, blah blah blah. When I worked on the main floor, uh, a whole bunch of nurses, CNAs, uh, other folks got suspended. Now, this is before I started working there. They got suspended because the director of that floor, because he hired me, he was in the hospital. And all of those employees, like on his floor, his staff, the ones he hired, all access his records, his medical records. Like, this is your director. Why are you looking in his chart? And I don't even think he was on that floor. I think he might have been on another floor. But it was a whole bunch of them that got suspended. Nurses, charge nurses, CNAs, secretaries, they all got, like, what? Is that serious? Like, is it that serious? That all y'all looked and got suspended, and then and they talked about it years later, and they were laughing like it was funny, because I think they wanted to see, because he was gay. He was gay, and I think they wanted to see if he had any, okay, just be all up in his business. I'm like, and they were laughing about it like it was funny. I'm like, really? Because after he hired me, he had, I don't know how many heart attacks, because he came back once and then he was gone because he had heart attacks. He ended up moving to England or wherever, because wherever they had free health care. So he moved over there, sold his house, and they moved over to like England, somewhere, wherever they got free healthcare. But I'm like, y'all really did that? You really jeopardized everything for that? To be nosy? Like, come on now. Um, so like I said, just because you have access to it don't mean you need to be all in. And if you that damn nosy, you ain't got no work to do. I remember when I worked at the first hospital, there was a unit secretary who used to read all the patients' H&P, which is the history and physical. She used to read all of it, like sit down and read their chart, like their H&P. I'm like, I don't even read. I Only time I look at an H&P is if a doctor put in a consult, and like say the patient is there. Let's say the patient had a heart attack, but the doctor ordered a consult for ortho or something like that. And I'm like, why are you ordering? So I'll go look in the H&P to see if maybe they have a history of something, a history of a broken bone, history or whatever. That way it'll make sense on why I'm calling, because, they just put a consult in, they don't really tell you the reason. But that's the only reason why I look at the H&P. I mean, I ain't sitting there reading these people's uh, history and physical. Who got time for that? You got too much time on your hand if you read, like, every patient. She used to read she knew everything going on with them people. Um, so like I said, just because you have access doesn't mean that you should look at it. Um, HIPAA is something else. I don't know why people play with HIPAA like it's just a joke, but it is not. Same thing with volunteers. The volunteers used to come around, and like they would have books for the patient. And I mainly only saw this on the one floor that had all the nurses crying. I usually only saw them over there. So the volunteers would come around with books for the patients to read, and the secretary would print off a list of like a census, and the census will have the patient's name, the diagnosis, the doctor, um, what room they're in. It had their account number, have their the account number. Oh God, I can't think of the other number. But it would have like all the information. Might have their date of birth, and they would give it to they would give the census, a copy of the census, to the volunteers. So then when the volunteers went in the room, and a patient in room 19 said, yes, I'll take a book, they'll know who it was. But I'm like, do you not understand that has all their information on there? Like, they have why they're there, like what their diagnosis is, their name, their date of birth, their diagnosis. I mean, it has all their information out. And honey, they came around one time when I was over there working, when I had floated to that floor, and I was like, what? I was like, no, because it had my name on it, because I'm the one that would have printed it out. You know what I'm saying? I'm the one who would have printed out that census. It had my name on it. Child, please, you ain't get. I ain't. So the charge nurse had to come. She was like, why don't you just print out? I said, because it got my name on it, and it got all the patients. It got the patient's name, their date of birth, their their account number. It got all the medical record number. It got everything. That got in it. So if the volunteer accidentally leaves that laying around, who printed it? It has my name on it. I can get in trouble. I ain't, no, not by no books. So the charge nurse, she printed it out and gave it to him. I'm like, do y'all not understand that you're giving information to people who should not have it? Like, they're volunteers, and then they got your name on it. I was like, whatever, that's y'all. That is y'all. Same thing. We had a secretary who used to throw the instead of putting the patient like shredding instead of shredding the patient's paperwork, like labs or whatever, because it has their information on there. It has their name, their medical record number, their date of birth, their doctor. It had, if they had labs done, it had the name of the labs, the range. It had all kind of stuff. Just throw it right in the garbage. I was like, oh my god, you supposed to shred that? That's why the shredder is right there. Like, oh, the y'all, y'all, please, I beg you, shred the people's stuff. If it's laying around, if you see it, if you don't need it, if it's not needed in the chart, shred it. Don't throw it in the garbage. And then same thing, even though you have access to certain things, don't mean you need to be looking at it. Okay, I'm telling you, if you got time to look up all this information on somebody, you ain't got no work to do. Like, I need you to go wipe something down or something. Okay, clean the charts. Like, get some goo going and clean the charts or something, because you got too much time. Now, like I said, and the reason why the unit secretaries didn't really have access to, like, social security numbers, because we really don't, like, what we need to know that for. And plus, people, they were getting positions. People, they're people who are organized, okay? And they will get jobs, get in position, and steal all this information so they can steal identities. Because, I mean, it ain't hard if you have somebody's name and their address and their birthday to get some other, you can steal people's identity just from that. So, oh my God, y'all, I have seen so much. I'm like, do y'all not understand that you violated HIPAA? Do you not understand that you could be fined for all this? I mean, the in this article, the employee was fired, um, but still the damage has been done. And then, of course, they had to offer uh, people credit, like free credit monitoring, because their social security number was compromised. So y'all, please, cause like, even, well, I ain't gonna say it, but please, please, if you have access, even though you have access to something, you don't need to be looking at it. Okay, just stick with you need to be doing. Make your day go by fast, and come on up out of there. Okay. So if you have any comments, you can put them below. You can follow me on my blog. It's Jamie Reed Booklist. That's where I talk about being a unit secretary. And I'll talk to you later. Bye.